So suicide is a major public health problem in the world, including Canada. It's the third leading cause of death in youth, and about 11 out of 100,000 people die by suicide in Canada. Suicide has been seen as a very important problem in First Nations communities in Manitoba, but also in Canada, with the Inuit population having rates that are even higher, more like 5 to 10 times the general population. So there's been a real effort within our group to try to understand what are the suicide risk factors, what are the causes of suicide in First Nations communities. In First Nations on reserve communities, one of the bigger issues is residential school trauma, the lack of the issues of colonization and loss of culture and loss of community, the loss between the youth, adults, and elders communicating together. Those are some of the major barriers that are seen as risks for suicide. So although mental health problems are seen as very important in general population samples, in First Nations communities, depression is not as strong of a risk, but more stressful life events. Among military samples, there's also been a concern in the military, especially the U.S. military, about suicide rates going up and up. We haven't seen as much of a problem in the Canadian military with suicide, although suicide is, of course, an important issue in Canadian military as well. Common problems that happen after deployment include post-traumatic stress disorder, depression, as well as alcohol problems. And at this point, we don't really have a good understanding of what leads to those kind of difficulties. We know that severe combat stress, seeing active combat, witnessing atrocities, being injured in the combat itself has an impact. But we also showed that a history of childhood abuse or neglect before deployment actually had a kind of additive effect. So if you had a history of childhood maltreatment and were exposed to combat, you were much more likely to have post-deployment mental health problems. And so this suggests that there are possibilities of trying to figure out ways to prevent before sending people into deployment. And looking at interventions that could be done, psychological interventions pre-deployment that may be useful. And this kind of work also is applicable to other groups that are at high risk of exposure to traumatic events, like military personnel, emergency personnel, as well as firefighters. Governments spend enormous amounts of funding trying to prevent suicide. However, the challenge is that many of these programs have had little evidence for efficacy. So often governments are spending money that make a lot of sense, but what we really encourage is that people should try to look at when governments are spending money to try to do a good evaluation to see whether the programs are actually doing what they're supposed to be doing.